So thank you, while Dowin's trying to get my slides up, thank you all for hanging in there. You know, it's kind of hard. I was told you get to summarize the day, and how do I summarize 4 hours worth of work? All right, so for those of you who got to see most, if not all, you heard, we're talking about best practices for a diverse and inclusive residency. So I wanted to just present to you some numbers, all right? Did I use the wrong? How do I make it go forward? The most important slide is the next one.
Work for you, the mouse? There we go.
Oh, great. All right. So when we talk about diversity in residency programs, I just wanted to show you some numbers. All right. So we're going to go back to that piece about diversity in residency programs. So this is race and gender data. This is U.S. emergency medicine residents, and this is from the ACGME data book from 2017 to 2018. So that's the most recent data book. We don't have it for this current year. They're usually a year behind, but you can get this information really just by going to the ACGME website. So when we talk about diversity in residency programs, this is it. These are the numbers that are out there that tell us a little bit about what race, ethnicity, and gender is in emergency medicine. This is U.S. EM academic faculty. This is AAMC data tables. This is from December of 2018. All right, so when you think about, we talk about diversity in residency programs. We focused a lot on that. There was a question about, well, what about the faculty? How do we do that? When you think about the work that's being done to increase diversity in residency programs, many of the program directors are working really hard on this. It really does go hand in hand, though, with not only the diversity of the residents, but it goes hand in hand with the diversity of the faculty. It's really, it's the diversity and inclusion of the department and the institution. So we're working really hard. Let's diversify our residency programs. So this is just something else to look at. These are the numbers. So this is the supply of U.S. medical students. So this is U.S. allopathic and osteopathic medical students applying to emergency medicine for 2018-2019. So yeah, these numbers really kind of show they're almost alike all the way through. We don't have a very diverse faculty in emergency medicine. You look at the gender numbers, you can see the gender numbers there. It's not a surprise that our residency programs look like this, and then this is the supply, so it almost mirrors it all the way through. So it makes you wonder, well, how do you diversify emergency medicine residencies? Well, I think the answer is you've got to diversify it all the way through. This is the data for the year before, U.S. medical students applying to EM 2017-2018, and then the table that I just showed you. It's not a whole lot of difference. Maybe you say, well, black went from 5.7 to 6.2%. Maybe that's something. It's really hard to know. I don't know that that's really a significant difference. So as we think about diversity of our residency programs, unfortunately, there are some real challenges with that, and a lot of that has to do with the faculty diversity, and you think about faculty diversity, when residents or prospective residents are looking at a program, they're looking to see what are they getting into, who's there, who looks like me. All right, and then you look at the supply, who's actually going into emergency medicine. I just want to bring it back. So at the very beginning, Marquita Hicks talked about the importance of diversity. So I showed you some numbers just to throw that in as part of the information that was being passed along today. That's the current data. It's as current as it gets, so you know what it is that you're looking at when you're thinking about diversity of residency programs. So let's take a little bit step back. Let's go back into the broader. Here's a definition of diversity. This is from the Center for Disease Control and Prevention. So you can see that up there. That's their definition. The definition I like to use is that diversity is really the richness of human differences. It's a very simple definition, but it really is a definition that is inclusive of all. This is what we're looking to do. So I should have gotten an illustration that had arrows going the other way. Here on the left, you've got a diverse group. You've got different points of view, different life experiences that allow problems to be solved in better ways, as opposed to the groups on the right where they're not diverse. They think in one particular way. So that goes to really the importance of diversity. It's all diversity of experience and thought. CDC NP, this is their definition for inclusion. All right, so there are official definitions. Definition I like to use is that inclusion is really the valuation of diversity. And in an inclusive environment, you actually cherish the fact that you have people who are different. All right, so so when you're thinking about this, about diversifying residencies, diversifying departments and institutions, you need to also think about the broader view. Actually, let me go back. So what you heard today, you heard that this can be done. So I'm listening, and I hope I didn't miss anybody. Highland, Colorado, VCU, Emory, Boston Medical Center, Yale, Brown. Those are just examples of work that is being done to really enhance diversity and inclusion. It's important that you consider inclusion. So it can be done. You heard examples today of how it can be done. Is it important? Well, of course it's important. So I have this slide about the business case. All of these studies that show that if you have a diverse and inclusive organization, you do better. Then you heard numbers today. Gender diversity, 32,000 deaths, 100,000 deaths based on race. So just that alone, 132,000 perhaps preventable deaths. So if there isn't, I can't think of a better business case for diversity and inclusion in really the house of medicine. So it's important. It's clearly important for the work that we do. You think about the future of diversity. We need this, diversity and inclusion. It's really important. Do we have hope of having that happen? You heard hope today. One of the things that when I asked my question about the ACGME and what kind of teeth it has, my hope is that they come down really hard on programs because that will add some teeth. It's a different incentive to be diverse and inclusive, but I think the future is bright. So what do we need to do? It's the choir that's here, especially the choir that's stuck around this long. This is the group that will move it forward. Why? Because you're already moving it forward. And it's from this that we need to grow. When you're doing diversity and inclusion work, right, you're trying to make this happen. This is actually what you're trying to do. All right, so it's not about getting the numbers right. That's an aspect of it. You know, you're trying to change those numbers, but that's only a small aspect of it. Diversity and inclusion is really about making the human experience the best that can be. All right, that's the human experience of us, the people that are the internal, the people that we work with. It's making sure that it's the best experience for all. What's the best experience? One in which you're valued for who you are and what you bring. Clearly, it's important for the patient experience. So we talk a lot about the patients, their experience. Absolutely, that's important. It's also important that we think about our experience as well, because when you put it all together, it makes it for the best experience for all. So thank you all for sticking around. You heard great work today, how it's being advanced within our specialty, within the House of Medicine. I think there's great hope for creating that diverse and inclusive residency program, department, and institution. So again, thanks for sticking around.